pleased today to announce this funding for Miscarriage. I believe it is the first time that there has been dedicated funding for Miscarriage in a federal budget, and I'm very proud of that. I'd like to ask Izzy, would you like to say a few words?
7 is the number of angel babies to which I am a mother. 10 is the number of years it took me to say goodbye to them and have my 2 living children. 5 is the number of minutes it takes between each miscarriage in this country. 0 is the number of years we've been tracking miscarriage numbers in Australia. 100% is the rate among experts that I interviewed who believe miscarriage rate numbers are going up. 4 is the number of years it took me to write my book about miscarriage, Hard to Bear. 1 is the number of months post-release when I founded the Early Pregnancy Loss Coalition with Jade Bellardi and Melanie Keep. 14 is the number of service providers who make up the EPLC and advocated for this change together. 18 is the number of policy advisors who support our coalition, all leaders in their field. 150, give or take, is the number of doctors, scientists, and most importantly, patients that I interviewed for my book. And here is what those patients told me. I don't want to be losing my baby while sitting in a waiting room next to a heavily pregnant woman who's trying to decide on baby names. New South Wales. No one would listen to me when I told them something was wrong, that the miscarriage wasn't finished. We had to call an ambulance to take me to hospital because I developed septicemia and I stayed there for a month. Victoria. I was so scared, there was so much blood and so much pain. I called the early pregnancy assessment clinic and the person who answered the phone said, "Calm down, dear, it's only a miscarriage." New South Wales. I wanted to have surgery to end the pregnancy. I didn't want to walk around with a dead baby inside me. The doctor in the ER said no, and when I asked why, he told me because he didn't believe in it and I should just go home and wait. Queensland. These stories get much worse when the person sharing their experience is from a marginalised minority, their first language isn't English, or if they represent a lower socioeconomic demographic. But 2024 is the most important number here today. It's the year that marked the beginning of the end of the dark days, when miscarriage was heavier, harder, and more dangerous than it needed to be. Every single patient who told me a terrible story are the people we're working for. And these are the people who will be forever grateful to Ged Kearney and her government for the first ever dedicated funding, in a federal budget for miscarriage. This funding sets people up for support who need it now, but most importantly, to create a viable and fit-for-purpose health policy for the future. This sends a message, and that message is, we are done. This time for women is over. It's time for us to care for birthing parents, their partners and their families, their children and their friends. There is so much work to be done, but we are ready.